Meet Carlos, 44 years old, a man who never in his life imagined that his daily eating routine could be directly connected to his sexual desire and function. If you asked Carlos whether he eats poorly, he would tell you no. He doesn't think he eats that badly. He's not living on fast food every meal. He's not drinking soda all day. He's not binge eating massive quantities. His typical day looks something like this: bread or cereal with coffee for breakfast, maybe with some juice, a quick lunch, often grabbed at a restaurant or cafe near his office, usually some combination of rice, beans, meat, and maybe a little salad, an afternoon snack of more coffee with cookies or crackers, dinner that's fairly similar to lunch, and then in the evening, while watching television or relaxing, some sweets, maybe ice cream or chocolate or pastries, as a way to unwind and reward himself after a long, stressful day. To Carlos, this seems like a pretty normal, standard eating pattern, nothing extreme or obviously unhealthy, certainly not something that would cause serious health problems. But what Carlos doesn't see, what's completely invisible to him without the right knowledge and framework to understand it, is that this eating pattern is creating a problem deep inside his body at the cellular level. Over the past several years, gradually and insidiously, Carlos has noticed changes that trouble him. His libido has steadily declined to the point where he rarely feels spontaneous sexual desire anymore. His overall energy and vitality have disappeared, leaving him feeling tired and sluggish most of the time. His mental clarity has decreased, and he often feels foggy and unfocused. His motivation and drive in all areas of life have diminished. And perhaps most painfully, his self-confidence has eroded as he feels less capable, less vital, less masculine than he used to feel. He's been confused about why all this is happening. Because he's not that old, he doesn't have any diagnosed diseases, his blood work at his last checkup was mostly normal, and he can't identify any obvious cause for feeling so diminished. The hero of today's story, and this may be your story if you recognize yourself in Carlos's situation, discovers something that changes his entire understanding of what's been happening to him. Carlos learns that his body has been existing in a state of constant, chronic, low-grade inflammation for years, caused primarily by his daily food choices, and that this silent, invisible inflammation is systematically sabotaging multiple systems in his body, including his hormonal balance, his vascular function, his brain chemistry, and his metabolic health. And crucially, sexual desire and libido are among the very first casualties when your body is chronically inflamed.
The inflammation is like a slow poison that gradually degrades function across all systems, and libido, being a luxury function rather than essential for immediate survival, gets shut down early in this process. Hello, and welcome to another video here on the channel. If you're new here, I create evidence-based, practical content about men's health, nutrition, sexual function, vitality, and living optimally. Please subscribe and hit the notification bell so you don't miss future videos that could dramatically improve your health and quality of life. And if what we discussed today resonates with you, if it helps you understand the hidden connection between what you eat and how you feel sexually, if it gives you practical strategies to reduce inflammation and restore desire through food choices, please leave a like to help other men discover this crucial information. Today, we're going to explore one of the most under-recognized causes of low male libido in modern society, which is chronic inflammation caused by poor dietary choices. In this video, you're going to understand exactly how inflammatory foods systematically sabotage male libido, even in men whose standard medical tests come back normal or mostly normal. I'm going to explain what silent or chronic low-grade inflammation actually is, how it differs from acute inflammation, and why standard medical tests often miss it until it has progressed significantly. I'm going to detail the specific mechanisms by which inflammation affects hormones, particularly testosterone production and function, how it damages circulation and vascular health, which directly impacts erectile function, how it depletes energy at the cellular level, leaving you exhausted, and how it affects brain chemistry and mood, making you feel flat and unmotivated. I'm going to explain why so many men waste time and money trying to fix their libido with supplements, medications, and other interventions while continuing to eat inflammatory foods every single day that are causing the problem, making it impossible for any other intervention to work effectively. And most importantly, you're going to learn which specific foods and dietary patterns create inflammation in the male body, which food choices actively reduce inflammation and restore healthy function, and how relatively small, strategic changes to your eating pattern can generate real, measurable improvements in libido and overall vitality within just a few weeks. This is not about extreme restriction, deprivation, or unsustainable dieting. This is about strategic, informed food choices that support rather than sabotage your body's optimal function. Let's start by understanding what chronic inflammation actually is, because this term gets used frequently but is rarely explained clearly. Inflammation is fundamentally your immune system's response to perceived threats or damage. When you cut your finger, the area becomes red, swollen, warm, and painful.
That's acute inflammation. Your immune system rushing to the site with immune cells and inflammatory molecules to fight any bacteria, clean up damaged tissue, and initiate healing. This type of inflammation is beneficial, protective, and necessary. It's short-term, it accomplishes a purpose, and then it resolves once healing is complete. This is not the problem. Chronic inflammation is completely different. It's a state where your immune system is persistently activated at a low level throughout your entire body, not in response to a specific acute injury or infection, but in response to chronic irritants, stressors, and triggers that never go away. Your immune system never fully turns off, never returns to baseline, because it's constantly detecting things it perceives as threats. These triggers can include poor diet, particularly excess sugar, refined carbohydrates and processed foods, chronic stress, inadequate sleep, sedentary lifestyle, obesity, particularly visceral abdominal fat, environmental toxins, and chronic infections. When these factors are present chronically, your immune system remains in a chronic state of activation, continuously producing inflammatory molecules called cytokines that circulate through your bloodstream and affect tissues throughout your entire body. This chronic inflammation is often called silent inflammation because, unlike acute inflammation, you can't see it or feel it directly. There's no obvious redness, swelling, or pain that signals a problem. You just gradually feel worse overall, more tired, more achy, less vital, but you can't point to a specific injury or problem. Standard blood tests often miss chronic inflammation until it becomes quite advanced, because doctors typically only check for inflammation markers if they suspect a specific inflammatory disease. A man like Carlos can have significant chronic inflammation affecting his health and function, while his standard annual checkup blood work shows nothing alarming. His doctor looks at his cholesterol, blood sugar, and basic metabolic panel, sees nothing drastically out of range, tells him he's fine, and sends him home, never checking inflammatory markers like high-sensitivity C-reactive protein, interleukin-6, or tumor necrosis factor alpha that would reveal the hidden inflammation. Now let's understand specifically how this chronic inflammation sabotages male libido through multiple interconnected mechanisms. First, inflammation directly suppresses testosterone production and function. Your testes produce testosterone under the direction of hormonal signals from your pituitary gland and hypothalamus. When your body is chronically inflamed, inflammatory cytokines interfere with this hormonal signaling axis. They suppress the signals from your brain that tell your testes to produce testosterone. They also directly impair the function of the Leydig cells in your testes that manufacture testosterone.
Additionally, inflammation increases the activity of the aromatase enzyme, which converts testosterone into estrogen. So, inflammation simultaneously reduces testosterone production and increases testosterone conversion to estrogen, giving you a double hit that dramatically worsens your hormonal profile. Lower testosterone and higher estrogen leads directly to reduced libido, decreased energy, increased body fat, loss of muscle mass, and diminished sense of masculinity and vitality. Second, inflammation damages your vascular system, specifically the endothelium, which is the inner lining of your blood vessels. Healthy endothelial function is absolutely critical for both erectile function and overall cardiovascular health. The endothelium produces nitric oxide, the molecule that causes blood vessels to dilate and relax, allowing increased blood flow. Erections require massive dilation of the blood vessels in the penis to allow blood to rush in and fill the erectile chambers. When chronic inflammation damages your endothelium, nitric oxide production decreases, blood vessels become less responsive and less able to dilate properly, and erectile function suffers accordingly. You might notice that your erections are less firm, less reliable, require more stimulation, or fade during sexual activity. This vascular damage also puts you at increased risk for heart disease, stroke, and other cardiovascular problems, because the same inflammatory process affecting the small vessels in your penis is affecting the larger vessels throughout your body. Third, inflammation depletes your energy at the cellular level by impairing mitochondrial function. Mitochondria are the powerhouses of your cells, the tiny organelles that produce ATP, which is your body's energy currency. When you're chronically inflamed, the inflammatory molecules damage mitochondria and impair their ability to efficiently produce energy. You feel this as chronic fatigue, exhaustion even after sleeping, difficulty getting through the day without excessive caffeine, and complete lack of energy in the evening when you might otherwise feel desire for sex. Sexual activity requires energy, both for the physical act itself and for the psychological arousal and desire that precedes it. When you're running on empty energetically because inflammation has damaged your cellular energy production, libido naturally disappears because your body correctly assesses that you don't have the resources to engage in this energy-intensive activity. Fourth, inflammation affects your brain chemistry and mood. The inflammatory cytokines circulating in your bloodstream can cross the blood-brain barrier and affect brain function directly. They interfere with the production and function of neurotransmitters, including dopamine, which is crucial for motivation and desire, and serotonin, which is important for mood regulation.
The result is often what's called sickness behavior, a constellation of symptoms including fatigue, loss of motivation, social withdrawal, decreased interest in pleasurable activities, low mood, and yes, loss of libido. From an evolutionary perspective, when your immune system detects that you're fighting an infection or dealing with injury, signaled by inflammatory molecules, it wants you to rest and conserve energy for healing, not run around pursuing sex. So inflammation directly suppresses libido as part of this sickness behavior response, even when there's no actual infection, just chronic inflammatory activation from poor diet and lifestyle. Fifth, inflammation promotes insulin resistance and metabolic dysfunction. When your cells are chronically inflamed, they become less responsive to insulin, the hormone that moves glucose from your bloodstream into your cells. This leads to elevated blood sugar, elevated insulin as your pancreas tries to compensate, and eventually can progress to prediabetes or type 2 diabetes. This metabolic dysfunction further worsens inflammation, creating a vicious cycle, and it also directly impairs sexual function because elevated blood sugar damages nerves and blood vessels, high insulin suppresses testosterone production, and the metabolic chaos generally makes everything in your body function suboptimally. All of these mechanisms are operating simultaneously in Carlos's body, interacting with and amplifying each other, creating a downward spiral of declining function, where each problem makes the other problems worse. His inflammatory diet is triggering all of this, but he has no idea because he doesn't understand the connection between what he eats and how he feels, and his doctor hasn't explained it to him either. Now let's talk about why so many men try to fix their low libido with supplements, medications, and other interventions while completely ignoring their inflammatory diet, and why this approach fails. Carlos might try testosterone-boosting supplements, libido herbs, erectile dysfunction medications, even testosterone replacement therapy, all while continuing to eat the same inflammatory foods every single day. Here's the problem with that approach. If you're pouring inflammatory fuel on the fire every single day through your food choices, no amount of supplements or medications will fully overcome that constant insult. It's like trying to fill a bathtub while the drain is wide open. You might get some water accumulation, you might see some modest improvement, but you'll never fill the tub. You'll never restore optimal function, because the fundamental problem causing the drainage, the inflammation from diet, is still fully active. This is why so many men are frustrated that supplements and medications don't work well for them, or provide only marginal temporary improvement.
The supplements aren't necessarily bad or ineffective, but they're trying to fix a problem downstream while the upstream cause continues uninterrupted. The only way to truly fix inflammation-driven low libido is to address the inflammation at its source, which for most men means fundamentally changing what they eat. So let's get specific and practical. What foods are driving Carlos's inflammation and need to be eliminated or drastically reduced? The biggest culprits are refined sugars and high fructose corn syrup found in sweets, desserts, sodas, fruit juices, and countless processed foods. Sugar is perhaps the most inflammatory substance in the modern diet. It spikes blood glucose and insulin, triggers inflammatory pathways, feeds harmful gut bacteria, promotes fat accumulation, especially visceral fat, and generally wreaks havoc on your metabolic and hormonal systems. Carlos's evening habit of eating sweets is likely doing more damage to his libido than anything else he does. Refined carbohydrates, including white bread, white rice, pasta, crackers, cookies, and most breakfast cereals, behave very similarly to pure sugar in your body. They're rapidly digested and converted to glucose, causing the same inflammatory insulin spikes, blood sugar dysregulation, and metabolic chaos. Carlos's breakfast of bread or cereal is starting his day with inflammation, and his quick lunch probably includes more refined carbs, compounding the problem throughout the day. Industrial seed oils and vegetable oils, including soybean oil, corn oil, canola oil, sunflower oil, and others that are used in virtually all processed and restaurant foods, are highly inflammatory. These oils are rich in omega-6 polyunsaturated fats, which, when consumed in excess relative to omega-3 fats, promote inflammation. The modern Western diet has a terribly skewed omega-6 to omega-3 ratio, sometimes 20-to-1 or higher, when the ideal is closer to 4-to-1 or lower. Every time Carlos eats restaurant food or processed packaged food, he's consuming these inflammatory oils. Trans fats, partially hydrogenated oils found in many processed baked goods, fried foods, and margarine, are extremely inflammatory and should be completely eliminated. Highly processed foods in general, anything with a long ingredient list full of chemicals you can't pronounce, tend to be inflammatory because they contain inflammatory oils, added sugars, refined grains, artificial additives, and are devoid of the anti-inflammatory nutrients found in whole foods. Excessive alcohol is inflammatory, impairs liver function, which is crucial for hormone metabolism, and directly suppresses testosterone production. While moderate consumption might be okay for some people, the regular drinking many men engage in is actively sabotaging their health and libido.
Certain people may also be sensitive to other foods, including gluten, dairy, or specific foods that trigger inflammation in their individual system, though this varies greatly between individuals. On the flip side, what foods reduce inflammation and support healthy male sexual function? First and foremost, fatty fish like salmon, mackerel, sardines, and anchovies are rich in omega-3 fatty acids, EPA and DHA, which are powerfully anti-inflammatory and support hormone production, brain function, and vascular health. Eating fatty fish 3 to 4 times per week or supplementing with high-quality fish oil can significantly shift your inflammatory balance. Colorful vegetables and some fruits, particularly leafy greens, cruciferous vegetables like broccoli and cauliflower, berries, and other plant foods rich in antioxidants and phytonutrients, actively combat inflammation, provide nutrients essential for hormone production, and support gut health, which is intimately connected to systemic inflammation. Healthy fats from olive oil, avocados, nuts, and seeds are anti-inflammatory and provide the building blocks for hormone synthesis, including testosterone. Extra virgin olive oil in particular contains compounds that reduce inflammation and support cardiovascular health. Quality proteins from whole food sources, including grass-fed meat, pastured eggs, and wild-caught fish, provide amino acids essential for hormone production, support muscle mass, which helps maintain healthy testosterone levels, and promote satiety, which makes it easier to avoid inflammatory junk foods. Herbs and spices, particularly turmeric, ginger, garlic, and cinnamon, have potent anti-inflammatory compounds and can be incorporated generously into meals. Fermented foods like sauerkraut, kimchi, and kefir support gut health and a healthy gut microbiome, which is crucial for regulating systemic inflammation. The overall dietary pattern that tends to be least inflammatory and most supportive of male health is one that emphasizes whole, unprocessed foods, plenty of vegetables, quality proteins, healthy fats, and strictly limits or eliminates added sugars, refined carbohydrates, and industrial processed foods. This doesn't require extreme restriction or never enjoying any treat foods. It requires making these anti-inflammatory foods the foundation of your daily eating, the default, with inflammatory foods being rare exceptions rather than daily staples. Now let me describe what Carlos's transformation might look like when he implements these changes. Carlos learns about the inflammation connection and decides to overhaul his diet. He eliminates the morning bread and cereal, replacing them with eggs cooked in olive oil with vegetables, or Greek yogurt with berries and nuts. He stops the afternoon cookies and crackers, replacing them with a handful of almonds or an apple with almond butter. He commits to preparing more meals at home where he can control ingredients, rather than relying on quick restaurant lunches cooked in inflammatory oils. His dinner is now emphasized grilled fish or grass-fed meat, abundant vegetables, and perhaps a small portion of sweet potato instead of white rice. And critically, he breaks his evening sweets habit, finding other ways to unwind, like going for a walk, reading, or having herbal tea instead of ice cream. The first week or two is challenging. He experiences cravings for sugar and carbs. He feels somewhat irritable and tired as his body adjusts, but he pushes through. By week 3, something shifts. His energy noticeably improves. He's waking up feeling more refreshed. His afternoon energy crashes have disappeared. His thinking feels clearer, and he notices with some surprise and encouragement that he's experiencing spontaneous sexual thoughts and feelings of desire that had been absent for months. By week 6, the changes are unmistakable. His baseline energy is dramatically better. His mood has improved. His body composition is changing, losing belly fat and looking leaner, and his libido has returned to levels he hasn't experienced in years. His erections are firmer and more reliable. He feels vital and alive again. Most importantly, he now understands the connection between what he eats and how he feels, and he has no intention of going back to his old inflammatory eating patterns because the improvement is too significant and valuable. This pattern of relatively rapid improvement when dietary inflammation is addressed is common and reflects the fact that the body has remarkable capacity to heal and restore function when you stop constantly damaging it. The inflammation wasn't causing permanent, irreversible damage yet. It was causing functional suppression. Remove the inflammatory insult, and function returns. Before we close, I want to emphasize several key points. First, this is not about perfection or never eating anything enjoyable. It's about making anti-inflammatory foods your foundation most of the time. The 80-20 or 90-10 rule applies. If you're eating well 80 or 90% of the time, the occasional treat in the other 10 or 20% won't derail you. Second, this requires actually cooking real food most of the time, which requires time and planning, but it's an investment in your health and vitality that pays massive dividends. Third, give it time. Some men notice improvements within a couple weeks. Others take a month or two to see significant changes as inflammation gradually reduces. Be patient and consistent. Fourth, consider getting inflammatory markers checked if possible. High-sensitivity CRP, fasting insulin, and hemoglobin A1C can give you objective data about your inflammatory and metabolic status and let you track improvement over time. And finally, this dietary approach benefits virtually every aspect of your health, not just libido.
You're reducing your risk for heart disease, diabetes, cancer, dementia, and generally improving quality of life and longevity. The libido improvement is just one of many positive outcomes. Now, I have a question for you, and I really want you to think about this and share in the comments. What food do you suspect is causing you the most problems right now? What item in your regular diet do you have a sense might be sabotaging your health and libido? Is it sugar and sweets? Is it bread and carbs? Is it alcohol? Is it processed junk food? Is it something else? And is this your biggest pain point? The thing you find hardest to change? Please share honestly in the comments, because acknowledging the specific foods you struggle with is the first step to changing them, and your comment might help other men recognize their own patterns. If this video helped you understand the hidden connection between inflammatory foods and low libido, if it gave you specific, practical guidance about what to eliminate and what to emphasize in your diet, please hit that like button to help other men discover this crucial information. Share this video with someone who needs to hear this. Subscribe and turn on notifications because I'll continue creating evidence-based content about nutrition, men's health, sexual function, and optimal living. Thank you for watching until the end and for being willing to look honestly at how your food choices are affecting you. Your willingness to make changes, even difficult ones, is what separates men who gradually decline from men who reclaim and maintain their vitality. Now go clean out your pantry, go shopping for real whole foods, and start eating strategically to support rather than sabotage your body. Your libido, your energy, your confidence, and your long-term health are all waiting on the other side of that commitment. I believe in you. See you in the next video.